Hi everybody, welcome to Dr. Manny's YouTube Learn Shops. This is part 1, which introduces you to Pediatric Physical Assessment. Now the objectives for this session are to briefly review the anatomical systems of the human body, identify certain basic milestones that might be important prior to doing the physical assessment, looking at assessment considerations for infants and children, then focusing on one way of getting a history, which will be the sample history, and then looking at certain physical assessment techniques. Now, as we go through, it's important to remember that there are 11 major body organ systems: the integumentary system, the skeletal system, the muscular system, the nervous system, endocrine, cardiovascular, lymphatic, respiratory, digestive, urinary, and the reproductive systems. It's only the reproductive systems, however, that vary significantly between males and females. The first system is the integumentary system, and it consists of the skin and its appendages, such as the hair, the nails, the sweat glands, and the sebaceous glands. And its functions are to protect, to provide sensation, and to eliminate waste products and excess water. From a protection point of view, it's to protect you from certain bacteria, viruses, dehydration, ultraviolet light and radiation, and trauma. It provides you with sensation for pain, temperature, touch, and pressure. It also has a focus on vitamin D synthesis and excretion of waste products and water. It's to help with immunity and regulation of body temperature. The skeletal system consists of bones, cartilage, ligaments, and it has two skeletons: the axial skeleton and the appendicular skeleton. And its function is primarily to provide body support and structure, protect internal organs, especially the vital organs such as the heart, the lungs, the brain, even though all organs are vital. It's to facilitate movement and the formation of blood cells. Also, storage of minerals and fat. The muscular system consists of the skeletal, smooth, and cardiac muscle. And their functions are primarily mobility and posture, stability via the tendons and joints, providing a circulation with the heart and the cardiovascular system, respirations which deal with the intercostal muscles and the diaphragm, digestion, which is bowel peristalsis, and urination, control of the bladder sphincters. The nervous system, you've got the central and you've got the peripheral, but the components primarily consist of the cerebrum, the cerebellum, the brainstem and spinal cord, and their functions are to continuously monitor body systems that deal with internal and external changes, provide sensory input data, integrate that data through processing, and then respond to that data. Sensory, integration, and motor functions. The endocrine system, the components are glands such as the pituitary, the adrenal, parathyroids, the islets of Langerhans, and thyroid. But there are more. And their functions are primarily metabolism, fluid balance, reproduction, and stress responses, such as your fight or flight response. The cardiovascular system consists of the heart, the arteries, veins, capillaries, and the blood itself, and its functions are The heart is essentially a pump, even though it does have certain endocrine functions as well, but primarily it's a pump. The blood, it's a transport system, and it transports oxygen, nutrients, hormones, waste products, and other products. Then you've got the lymphatic system, and the lymphatic system consists of ducts, nodes, and vessels and capillaries. Its functions are immunity, to defend you, prevent excessive fluid in the body, peripheral edema, and maintain fluid balance. It absorbs and transports fats. The respiratory system consists of the upper and the lower airways. The components are essentially the pharynx, larynx, trachea, the bronchi, bronchioles and alveoli, and the diaphragm. The functions are to defend and protect, provide humidification of gases being inhaled, provide a medium for gas exchange, oxygen delivery, and CO2 removal. The urinary system consists of the kidneys, which contain nephrons, tubes, the ureters, the urethra, and the urinary bladder. Its functions are to eliminate nitrogen or nitrogenous wastes, regulate water balance, maintain acid-base balance, and to release erythropoietin when required to produce red blood cells. The reproductive system in pediatrics is important, but it's not as important as in adults. However, the functions are to produce egg and sperm cells, to transport and sustain these cells, to nurture and develop the embryo and fetus, and to produce certain hormones. Okay, it's important to remember these points as basic milestones. So, basic milestones, an infant typically smiles at about 6 weeks. It typically sits at approximately 4 months. It typically stands at approximately 10 months. And walks approximately at 12 months of age. Additional considerations when doing a pediatric physical assessment is to remember that you should ensure privacy, a quiet, warm environment with light that isn't too bright and certainly not dark. And it's always helpful to have a parent there or someone that the child knows to promote cooperation. It's important to have these products available, but there are many more depending on the physical assessment that you're performing. It's important to remember hand hygiene practices. Rubber gloves can be helpful, however hand hygiene practices are recommended by the World Health Organization as being preferable, but if you're coming in contact with someone who could be infective, rubber gloves are important. A stethoscope, a thermometer, a sphygmomanometer, pen light, possibly a pulse oximeter, tape measure, weigh scales, and other items that may be important for that specific physical assessment. Now, it's always important when using any equipment that you use the equipment that is correct. The equipment that is the correct size for the patient that you are assessing. Whether it's a blood pressure cuff, whether it's a pulse oximeter and the transducer probe, placement on the correct body part is important, otherwise it could provide misleading information. It's always important to do a daily weight. Now, there are 3 equations that can be used to calculate the mean weight for age. And these are just some examples. Infants, less than 12 months of age, typically weight in kilograms is age in months plus 9 divided by 2. In children aged 1 to 5 years of age, its weight in kilograms 2 times age in years plus 5. Or older children, weight in kilograms equals age in years multiplied by 4. But you can use whatever formula you like to estimate weight. When looking at patients, it's always important to do a targeted patient history. And I've just given you one example here, which is called SAMPLE. And SAMPLE deals with an acronym that provides you with signs and symptoms, allergies, medications, a past medical or surgical or appropriate history, the last oral intake that they had, and events leading up to why they presented. So a sample history basically is S, signs and symptoms, or what was the chief complaint that brought the patient into hospital, or why the parents brought their child, infant, into hospital. A deals with any allergies that they might have. M, any current medications that they might be on. P, any of the past histories. L, the last oral intake, just in case an intervention is required that may require an empty stomach or awareness by the physician or the healthcare provider that there could be a potential for regurgitation or vomiting. Any events leading up to the event. So the sample history is just one type of mnemonic acronym to assist any healthcare provider or professional to remember key questions for a physical or a medical or nursing assessment. So let's review and remember. S is signs and symptoms. So have a look at the picture. Essentially with physical assessment, what you see is what you know. If you don't know anything, you're not going to see anything. You're not going to hear anything. You're not going to smell anything. Because physical assessment is primarily, as we'll discuss later on, 70% inspection. It's what you see, hear, and smell. Look at the picture of the little girl. She's doing the universal sign that indicates possibly she might be choking. What are the signs and symptoms? She appears very anxious, has breathing difficulty, and she cannot talk properly. Her chief complaint, which she can't tell you, is that she can't breathe. Does she have any allergies? None that you're aware of. Is she on any medications? None that you're aware of. What's her past medical history? Well, there isn't any past medical history that is relevant. She's always been a healthy kid, and now she's a healthy 10-year-old kid. What was the last meal or intake that she had? Well, one of her friends gave her a biscuit at school. What were the events leading up to the chief complaint? At school this morning, her friend offered her a biscuit. she ate the biscuit, and suddenly she appeared to be choking. She can't talk and she cannot breathe. That's an example of the sample system for history taking. What you do after depends on you. It could be the Heimlich maneuver, or referred to as abdominal thrusts. It could be back slaps to try and alleviate the obstruction. You may call the emergency medical system. Now let's review physical assessment techniques. And typically there are four. There's inspection, which is typically performed first. Then there's palpation, which is typically performed second, except if you're doing an abdominal assessment. There's percussion, which we're not going to be spending too much time on, which is typically performed third. And then there's auscultation, which is typically performed last. However, you can perform any of these techniques in any specific order that you choose, depending on your patient's or the infant or child situation. Inspection, palpation, percussion, auscultation. Inspection is the first assessment technique. And look, 70% of physical assessment is inspection. So this is probably the most important. What your eyes see, what your nose smells, what your ears hear. So for example, if you see that the kid looks pretty good colour, doesn't seem to be distressed. You smell, well, body odour seems to be okay. You listen, they don't seem to be making any dramatic noises with their breathing or crying emotionally, then the kid is probably okay. Or stable is a better word. Because again, inspection is about what you see. And as I indicated earlier, if you don't know what normal is, you won't see anything. If you don't know that a stridor is something that is an abnormal sound, then you won't hear anything. So inspection is the first physical assessment tool where you use all three of your senses. What you see, what you hear, and what you smell. And this is probably the most important one because you can get a lot of information by inspecting without actually touching. And in pediatric patients, you probably don't want to touch them if they don't know you. Because if you touch them and you don't know them, they may be distressed, and this may lead to a deterioration in their condition. Inspection. Then you've got palpation. Palpation is basically touching the patient gently and watching for responses. The tools that you would be using are your finger pads, your fingertips and nails, your forefinger using your thumb, the ball of your hand, the back of your hand, the whole of your hand. I mean, for example here, your finger pads are used to determine maybe temperature of the skin, pulsations, whereas your whole hand could be assessing their grip, their strength. So your hands, your fingers are all tools that are important for palpation. And you touch the patient and you watch for responses. If you're using, for example, your finger pads to determine whether the patient has got abdominal tenderness, you're observing to see the response to your touch. Palpation. Palpation can be light, which uses your fingers and pushes gently to a depth of 1 to 2 centimeters. And it identifies texture of the skin, temperature of the skin, moisture, pulsations, tenderness, vibrations, thrills, or masses. Palpation can also be deep, and this uses the hands and pushes gently to a depth of approximately 4 to 5 centimeters. And its primary function is to identify organs such as the liver, the spleen, the kidneys, the bowel. In older patients, possibly the ovaries, and it's to determine size and texture of the organ. Palpation can also be bimanual, using 2 hands. And this gently pushes into a depth of approximately 4 to 5 centimeters. And this is to identify and isolate organs or masses that involve the liver, the spleen, the kidneys, the ovaries, the bowel. And again, it's to determine size and texture. But this requires practice in order to get the information that you need. And typically it's done by physicians or healthcare providers that have become an expert in the skills of physical assessment. Percussion is a really important tool. However, it requires a lot of practice. And it provides a lot of important information, which typically today is identified with more advanced techniques such as possibly a chest x-ray, an abdominal x-ray, CT, and so forth. But percussion is a tool where you use your finger pads and the back of your finger. And this can be direct, indirect, or blunt. We'll only be discussing indirect because this is the most common one. Direct and blunt are typically not used as often today. But percussion, indirect percussion, is using your finger pads and the back of your finger to make sounds and listen to those sounds, because the sounds can give you information. Indirect. Now, sounds created by percussion include tympanic, which is a drum-like sound, which is typically heard over the urinary bladder when you percuss, or, as you see on the chest x-ray there, air in the stomach. You can also have a resonant or hollow sound, which occurs over normal lungs, because the lungs are full of air. They're not solid. You can also have a hyper-resonant sound, which is like an echo. And this is when the lungs or the thorax or even the abdomen is hyperinflated. It has a lot of air in there. And this can occur in chronic lung disease, which pediatrics can have. They can develop a pneumothorax. They can have a lot of air in the abdomen or just under the diaphragm. You also have solid sounds, which are dull. And typically, these occur over the liver, because the liver is a solid organ. The kidneys are a solid organ. However, this can occur in abnormal situations. Look at the chest x-ray. In the right middle lobe, as a result of a mass or a collection of fluid, or lung collapse, which can occur with consolidation. It can also be a very solid sound, which is a flat sound, which typically occurs over normal bones. But if you heard that over the lung or in the abdomen, this could indicate that there was a problem. Percussion. The sounds that are created are tympanic, which are drum-like, resonant, which means hollow, hyperresonant, extremely hollow and echo-like, dull, very solid, flat, extremely solid. Then you have auscultation. An auscultation uses typically an acoustic stethoscope. And the stethoscope is for listening for heart, lung, bowel, and blood vessel sounds. Now typically the heart, lung and bowel make sounds that are normal. Blood vessels don't typically make sounds. And if you hear them, this is a bruit. But the stethoscope is for listening to heart, lung and bowel sounds, and sometimes in abnormal situations, blood vessel sounds. So let's review. Which assessment technique would you recommend for the following conditions? This kid's got facial bruising for whatever the reason. She's come into your emergency department. You would be using inspection. This kid's come into your emergency department with chest trauma by the looks of it. Which inspection techniques would you use? You look, you touch gently to see how painful it is, and you might actually auscultate the chest to listen for chest sounds, which could be cardiac or they could be respiratory. I mean, he could have cardiac contusion. He could have injuries to his lungs, which decrease air entry. You've got an infant that's come into your department with a distended abdomen. What techniques would you recommend? All of them. Inspection, you're looking. Auscultation, you might be listening for peristaltic bowel sounds. You want to listen with the stethoscope first, but it's your choice, because after light palpation or percussion, you might alter those bowel sounds. They might disappear, or they may become proactive. Light palpation to assess for abdominal tenderness, and percussion to see whether there's abnormal sounds. And there will be, because the child has obviously got ascites and there would be a lot of fluid in the abdomen. You've got a little girl here who's coughing. What assessment techniques would you recommend? Inspection. Be careful. She may have any number of upper airway or lower airway, or upper or lower airway problems related to her coughing. Coughing's probably good, because if it was quiet, she may have epiglottitis, and by you interfering with her, she may obstruct her airway completely. So it's probably a good idea just to inspect and talk to the parents regarding the child's condition. Just observe and intervene as required. You've got a rash here. What assessment techniques would you use? Probably just inspection. Palpation might be recommended, but it could be infective. It may not be. It probably is. Using a glove, well, a glove doesn't provide you with any real information other than to observe whether the papules are painful. but you could probably ask the child whether they are painful. Then you've got skin excoriation. This could be a nappy rash, possibly. Inspection. This little boy's got chest pain. His mother's brought him into your emergency department, and he's typically demonstrating what is called Levine's sign. And Levine's sign is where a child or an infant or an adult grasps the left side of their chest, indicating that it's heart pain. What would you do? As far as your assessment techniques, you could use inspection, light palpation, just in case it is a musculoskeletal problem, and auscultation, possibly to listen to the heart. Then you've got a condition called Pectus excavatum, which means funnel chest. The child's been brought into your department. Which assessment technique would you use? Probably just inspection. Little boy with bronchospasm and asthma. What assessment technique would you use? You can use inspection to observe whether he is stable or unstable. And a good way to think of stable and unstable is, do they look good or do they look bad? Do they look well or do they look unwell? If they look good or well, they're probably stable regardless of their condition or illness or disease. If they look unstable, unwell, bad, then it may require further interventions. Inspection is probably the most important tool in a pediatric in this situation. If you auscultate, you may aggravate them, you may upset them, and this may lead to further breathing difficulties. However, it's something that you would decide at that point in time. So you might auscultate the chest to listen for bronchospasm, for wheezing, for gurgling, for rales, for rhonchi, for something that might indicate the condition is bad or okay. Facial trauma. Which assessment technique would you use? Inspection. You might palpate to see whether it's painful, but they may already be telling you that it is painful. So just inspection. Outside, inside. Okay, that's the end of part 1 in pediatric physical assessment, which introduces you to pediatric physical assessment and certain techniques. If you've enjoyed this, if you thought it's been of any benefit to you, check out part 2 or any of the other Dr. Manny Learn Shops that you can see on YouTube. Thanks.